Okay, well, hey everybody, this is Dr. Bulow, or I'm Dr. Bulow, with Revive Upper Cervical, and we're here in the clinic on a Friday. Normally, I do these interviews with my patients on Tuesdays. We call them Testimonial Tuesdays. But Sierra was just in today, and we just had to sit down and share her story with you. So please introduce yourself, Sierra, to the Revive community.
Hey, Revive community.
So, Sierra, how long have you been a patient of ours?
I started about 3 months ago.
Yep. And how did you hear about us? What was going on? Well, first of all, what was going on in your life that made you start looking for clinical care? What kind of conditions or pains or symptoms were you dealing with?
Right. I had past concussions.
Yeah.
I also used my hands a lot in my work, and I was waking up with tingly sensations on both arms.
Both arms, yeah.
I had migraines. I suffered from probably about 8 times a month, but it took me out for 2 days by the time.
Some people will say, I get migraines, but you got migraines, like actual migraines. So for someone who doesn't know the difference, what's the difference between a headache and then what I would say is an actual migraine?
A migraine, from my experience, I would have aches and pains all over my body. I had to sit in a dark room. That's why it would be up to 2 days of, ice and heat and things over my eyes because I was so sensitive. It was to the point where I would get nauseous.
I was just about to ask you about that.
Super nauseous and down for the count.
Yeah, that's usually the hallmarks of migraines are the nausea, light sensitivity, hearing sensitivity, just everything has to be shut off.
Yes.
How long did you have those? When did those start for you?
It was some time. It was my last accident that I found it more after my son was born, that I was continuously getting them.
And if you're 8 times a month, it's a couple a week. It's pretty intense.
It was.
And so how did you hear about Revive?
Actually, you had a new machine that you're promoting on Facebook, and I came and saw you. I requested a appointment right online with your promotion, and I think we saw each other, met, and consulted within the same week.
I think we had put a page, and this is what's so important about these interviews is sharing this video. I think all I did was I shared a video on one of the community pages in Mars, which is a neighboring community of Cranberry. And so I always say this, if you're watching this and this is something that resonates with you, we'd love to help you. But you never know. It may not resonate with you, but you might know someone, or you might share this video. There's people that you don't even know that are in your life that are dealing with the same problems. You know what I mean? And you just don't know what impact it'll make. So what impact did it make for you? How have you been doing over the last few months?
Oh my goodness, I can't praise you enough. I haven't had a migraine for about a month and a half.
That's awesome.
And I believe my last migraine was stress-induced. So, I mean, it's about lifestyle change. And when you're constantly, you have a regimen with chiropractic care, taking your lifestyle and really concentrating on the holistic care of one's body. It's made such a difference. I mean, awesome. I have no tingling in my arms. I use my less dominant hand as well, just to be a little safe and
share the responsibility.
Right. But like the stretches that we do and we learn and, taking that time to, adjust yourself. Or when you're going like this on the phone, you're like, no,
hold it up.
That's a common thing to do.
When you're watching this video, make sure it's up here.
Up here.
That's right. Yeah.
So just those little things that have helped. And like
awesome.
I said, the consistency, you see the aggravation in my body every time before our appointment and every time after.
Yeah, we do thermal imaging to measure for inflammation before and after. And the regimen of care is not necessarily that someone needs to be adjusted 3 times a week for the rest of their life. The regimen is just keeping an eye on it. So we don't always adjust. There's been visits where you come in and everything looks good. Yeah. Who would have thought, right? It's hey, everything's good. It's just the idea that keeping an eye on your health, knowing your numbers, just like you check your blood pressure, your height and your weight, all these things. We just advocate checking the inflammation levels in the most important area of your body, which is your brain. Right. And as long as we keep those inflammation levels down and we have a healthy communication, things tend to do well. So one question I always, I guess 2 questions. What is the difference it has made, or what have you noticed, if any, the differences? So now you're out of pain, but now because of that, what are you able to do? Are there differences in your quality of life or day-to-day activities that were otherwise being limited?
My quality of life has changed tremendously.
That's
so
cool.
yeah, it really is. Not just with the migraines, but actively my moods.
Yeah.
Yeah, like
people who aren't in chronic pain don't realize when you're in chronic pain,
you get cranky.
Yeah, it's sad, and it's tough for people who aren't in that pain to relate with someone who is in pain,
right?
Because they just don't know.
Yeah.
You know what I mean? But that's cool. And then the other question I would say is, just as we kind of wrap it up,
sure,
what would you share with folks that maybe are dealing with similar issues? Maybe they've been to chiropractors in the past. Maybe, what would be your last 2 cents for everybody? And then we'll close her down.
Yeah, your body, if you know what's wrong and you find out what's wrong, like I did, you were able to consult with me and really break it down, what's going on in my body, what my body is naturally doing, and adjusting that. It'll make a whole world of a difference.
Yeah.
It's just knowing it. And it's letting your body do the work. And like you said, there's been many times that my body was just doing the work. So we didn't need to do any adjustments.
Yep.
So it really is knowing your body and bettering your quality of life.
It's awesome.
Yeah.
Can't say it better right now.
Yeah.
That's it. We're going to close with that. You got to know your body and better your quality of life. So thank you, Sierra. Thanks for hanging out. And
awesome.
Thanks, guys, for watching. Like I said, please feel free to share it. You never know what kind of lives you might change. And if you have any questions or if we can help, let us know. Bye, guys.
Bye.